Hi everyone! Ever wondered where your pee comes from? Or what your body does with all the waste it makes? Well, let's talk about the urinary system, your body's personal cleaning crew. You'll find out more about your kidneys, bladder, and we'll show you just how amazing your system really is. Come on.
First up, the kidneys. A paired bean-shaped set of organs located in the retroperitoneal space of the abdominal cavity. Internally, the kidney is divided into an outer cortex, an inner medulla, and a collecting duct called the renal pelvis. It is formed from the minor calyx and the major calyx, which funnels the urine into the ureters. The kidney is composed of millions of nephrons, the functional unit of the kidney, which filters blood and produces urine. The nephron starts with the renal corpuscle, consisting of a glomerulus surrounded by a capsule, leading into the PCT and further into the DCT, and then into the collecting duct, the nephron loop, and then the collecting duct. They filter waste products like urea and creatine from the blood. Next, moving on to the ureters, which play a vital role in ensuring one-way flow of urine from the neck of the ureter. A combination of peristalsis, gravity, and valve-like entry into the bladder ensures efficient and safe flow. The storage of it all, the urinary bladder has 4 parts: the apex, body, fundus, and neck, which connects to the urethra. It serves as a reservoir for urine. The main function of the bladder is to store urine and release it when needed. And finally, when it's time, the urethra is the exit tunnel that lets urine out. The urethra's primary function is to expel urine from the bladder to the outside of the body.
Your kidneys do something pretty wild. They filter about 50 gallons of blood every single day. Inside each kidney are millions of tiny filters called nephrons. These guys separate out waste, extra water, and stuff your body doesn't need. The clean blood goes back to your body, and the leftover waste becomes urine. The order of blood flow through the kidneys goes renal artery, segmental artery, interlobar artery, arcuate arteriole, interlobular artery, afferent arteriole, glomerulus, efferent arteriole, peritubular capillaries, interlobular vein, arcuate vein, interlobar vein, and finally the renal vein.
Sometimes things can go wrong with your urinary system, like a urinary tract infection or UTIs. This happens by bacteria entering through the urinary tract, through the urethra, and out of the bladder. Usually more common in females rather than males. Some of the common risk factors include things like sexual activity, certain types of birth control, and even just the female anatomy. Because women have a shorter urethra, it's easier for them to contract UTIs. And another risk factor is any blockages that may be already in the urinary tract, but that's usually for males. Some of the most common symptoms include burning during urination, strong urge to urinate constantly, urinating only small amounts, cloudy or signs of blood in the urine, and strong odors.
Luckily, when it comes to UTIs, there are effective treatments. Some ways you can prevent getting a UTI is by staying hydrated and drinking plenty of water, urinating regularly, especially after sex, and practicing good hygiene. For example, wiping front to back after using the restroom to avoid spreading bacteria from the rectum to the urethra. Wearing breathable cotton underwear and avoiding irritating products like scented soaps or sprays can also help reduce those risks. If you do contract a UTI, the first step to do is to consult a doctor. From there, they can diagnose the infection, typically with a urine test, and prescribe the best antibiotic treatments for you. Now, if the antibiotics are taken as directed, most UTIs will clear up into 3 to 7 days.
Another possible urinary tract infection may be kidney stones, which can hurt. And they're kind of pebble-like pieces that form when there are high levels of calcium, oxalate, and phosphorus in the urine. So they're usually there, but when the levels are high, it can form kidney stones. Usually they vary in size. If they're smaller, they can pass through the urinary tract, and it'll still cause some pain, but not nearly as much as when they're larger. Larger kidney stones can pass through, but it'll cause severe pain and even possibly bleeding. Some symptoms for this disorder might include the constant feeling or needing to urinate, just like a UTI, pain during urination, sharp pains in your lower abdomen, back, or groin area, and possibly a hematuria, which is bleeding during urination.
And that's why it's important to stay hydrated and listen to your body.
And now for fun facts.
Fun fact number 1, your bladder can hold up to 2 cups of urine, but you feel like going at just 1. Fun fact number 2, you only need 1 kidney to live a healthy lifestyle. That's why it's possible for kidney donations.
Fun fact number 3, your body pumps about 50 gallons of blood a day, but only 1.5 quarts of urine efficient.
Fun fact number 4, the average adult produces 6.3 cups of urine a day.
So today we learned that the urinary system filters blood and makes urine and keeps your body clean.
It includes the kidneys, bladder, ureters, and urethra.
And those little nephrons, they're working all day, no breaks.
And guess what? Your kidneys are filtering right now.
Take care of your urinary system. Drink water, stay healthy, and if something feels wrong, talk to your doctor.
Say bye!
Hey! Bye!